Let's continue our focus now on the state of Gauteng as it gears up to elect a new premier today. Earlier on, our reporter Govan Whittles, who's outside the provincial legislature, tackled youth-related issues. Let's now focus on public health services and social services, specifically issues around service delivery. Govan is part of our team just outside the legislature. He joins us now once again live. And I wonder what community organizations are saying, Govan, as we prepare for this change in the legislature.
Well, they have a lot to say. I'd like to welcome you back to the Gauteng legislature. It's only a few hours until that special sitting that's expected to elect Panyaza Lesufi as the new premier of Gauteng. And the questions we're asking is, what kind of province will he find? And what are the urgent issues that will be raised by community organizations and entrepreneurs? That's what we talked about in the last hour, but now we'll take a focus to healthcare. And joining me, I have the chairperson of the Gauteng Treatment Action Campaign, Mr. Monwabisi Mbasa, and I'm also joined by Mr. Vuisile Plaiki. He's a youth and community activist all the way from the West Rand. So what is the state of healthcare in Gauteng? What will Panyaza Lesufi find in Gauteng's communities? He's been an MEC of Education for almost 2 full terms, so he knows Gauteng very well. But let's listen to the people who actually live in these communities and are part of these organizations. Mr. Mbasa, let's start with you. What is the state of healthcare in the communities in Gauteng? And what will Panyaza Lesufi find as he takes over this role as Premier?
Okay, thank you very much. Good morning to yourself and good morning to the viewers at home. Actually, the state of health in Gauteng is in disarray. So what is going to find is that actually you've got clinics that, have shortages of staff, shortages of medication, and obviously they've got issues of load shedding as well, which disrupts the services. And we want him to find a way that they put more budget to deal with issues of TB. As you would know, that TB, is responsible for over 60,000 deaths on a yearly basis. And we want him to ensure that he deals with the issue of corruption as well. You've got issues of medical legal claims, which has gone, quite exponentially to billions. So we want him to cap that particular, rot within the healthcare system.
We know that the clinics are responsible or are the prerogative of the municipalities at the city level, but the provincial hospitals have been in focus over the last 2 years. They've been described as being in a state of decay. The services have been severely criticized. What do you think he should do about that?
He should ensure that he addresses the issues of shortages of staff, like I said, and the issue of infrastructure as well is dilapidated, and you've got shortages of beds, you've got shortages of staff in critical, wards like TOP, labor, and so on. So obviously the service delivery is quite poor there, and that's why you'll find people sleeping on the floor, giving birth on the floor. Those are some of the issues that are quite inhumane in our view. As Treatment Action Campaign, we are campaigning for change with respect to that. They must put more budget to ensure that they deal with those issues in as far as hospitals are concerned.
And we'll get to a number of those other issues. Let me bring in Vuisile Plaiki. Mr. Plaiki, you're from the West Rand. You deal a lot with community issues. What will the Premier find as he takes over this new role? What are the urgent things he needs to address?
Good morning to you and your viewers at home. Look, there is a whole lot of issues that he will find. To start with, there's a high rate of crime that he needs to curb, of which it is somehow because of zamazamas that have been taking place in the West End. As you've been seeing from time to time, there's an outcry of zamazamas and crime. Your roads, they are not in a good state. Everywhere, you can't travel for 1 kilometer without getting a pothole. Your infrastructure, your stormwater issues, they are a crisis. Now, our people are facing load shedding, of which it's also a huge problem that he needs to address together with his executive.
Let's talk about load shedding, because right now, as we're conducting the interview, the generators are running at the Gauteng provincial legislature. There's load shedding in the area, and they need the backup electricity. Not many of the townships have these generators available in government facilities. We saw reports of police stations where generators are not working, being at risk, and of course it affects healthcare as well. What do you think he should do in that regard, and do you have faith in the government to do anything?
Look, he needs to be decisive on the issue of load shedding, because the gap between the rich and the poor keeps widening, of which our people can't afford your generators, your UPSs to ensure that there is lighting. Therefore, there needs to be a way of ensuring that the issue of load shedding it is addressed, obviously, in the interest of the poor and our own communities.
Do you think that the government has supplied enough generators to keep the health services running during load shedding?
Absolutely not. There are quite few, and there's an issue of budgeting when it comes to diesels. But I want to touch base on the issue of load shedding. Load shedding affects, public health care system severely. You've got issues of, of generators that are not being supplied with diesel. Now, as treatment action campaign, we are calling for Premier, the incoming Premier, to ensure that fully exempts the public health care system from the national grid that is grievously affected by load shedding, and the water cuts as well. They should be fully exempted. They must build boreholes and ensure that they've got reservoirs which are designated to supply, the healthcare system.
So what do you think? Do you think that's possible? Full exemptions for load shedding and boreholes to give alternative water supply, considering the state of the community?
Look, there is, if there is willingness of leadership from the Premier and his executive, because our people can't be dealing with the issue of electricity. Meanwhile, there's also a shortage of water. For example, our people of Joburg, they don't have water. It's been days without water, yet they have to deal with your issue of electricity. Now, a 110-year-old lady in Midlands, a granny, has been evicted from her own home. So we need decisive leadership so that the government itself can be quick in responding to issues of our people and ensure that that old lady at Midlands, her issues are being properly addressed.
It's the same government, though, from the ANC. So what could Panyaza Lesufi as Premier do that David Makura has not already prioritized as Premier? What real difference is there to make?
Look, it may be the same government, but if there is willingness from leadership, therefore change can be there and issues of our people can be properly addressed. Because the only thing is to ensure that the ANC and its government, they are there for the people, they are responsive to issues of our people, and they are found where our people are at.
What do you think he can do that's different that David Makura has not done?
No, it's not a matter of personalities, but it's about the principle. It doesn't matter whether it was Makura or Panyaza. All we want is we want him to extrapolate from where David Makura had left off. But I want to address the part of feasibility of full exemption of public healthcare system from the grid. You've got Steve Biko in Tshwane, which is fully exempted. You've got several facilities in Western Cape which are fully exempted. That means all we need is a political will. This is feasible, and we want him to address that part quite expeditiously. So whether it's a matter of the same government, it is quite immaterial, as long as there will be that political will to address the challenges of our people. That's all that we need, because the resources are there. The only thing that you need is decisive leadership, that he will ensure that as he will be assuming this position, he will ensure that the executive responds to the issues, responds to the challenges, because really we can't afford to find ourselves in limbo in this state of disarray. So we need him to ensure that applies decisive leadership.
Finally, gentlemen, Mr. Plaatje, Panyaza Lesufi is coming into this position to prepare for the State of the Province address, which would be next year. He'll prioritize a few issues and hopefully outline his broader vision in that SOPA next year. But what do you believe as a community activist should be his most urgent priorities to address?
Look, it needs to be the high rate of unemployment. It needs to prioritize infrastructure and its maintenance, because really that speaks a lot. You also need to ensure that young people, more especially those in business, they are given opportunities, they are given funding to ensure that unemployment and poverty is fought at all angles with all stakeholders involved in it.
Thank you. That is, of course, part of their strategy. What do you believe should be his urgent priorities? We're assuming, of course, addressing the healthcare.
Yes. Number one, it should ensure that there's sufficient budget to address issues of HIV and AIDS and TB. We need to ensure that they hire more staff. They must move away from this frozen, post. They need to hire more staff so that can comprehend this intake of the public that requires the services there. And we also want to make sure that he ensures that there's access, adequate access of youth-related or youth, services to the facilities. Ensure that there's general access, to medication. They address the issue of stockouts, especially of the chronic medication. So we want him to ensure that he leads a team that is competent to ensure that it deals with those issues. Nobody should go home from the facility without medication. He should ensure that the issues of filing system is in place and ensure that they put adequate infrastructure to respond on issues that relates to health, to ensure that
of course there are a number of issues to address in healthcare. I'd like to thank you, Mr. Monwabisa Mbasa, the chairperson of Treatment Action Campaign in Gauteng, and Mr. Vuyisile Plaiki is a youth and community activist from the West Rand. Expectation is growing, and as Mr. Mbasa says, all eyes will be on the team that Panyaza Lesufi appoints to address some of these challenges. And we might get more information on that towards the end of the week, as the new Premier will likely consult with the alliance partners before making any decision on his new cabinet. It's back to you, Ayanda.
Certainly all very important decisions, whatever they are. Govan Whittles, thanks very much indeed. Govan's part of our team, live to us there from just outside the Gauteng legislature in Johannesburg.